Hi, my name is Joey Franchini, student physical therapist, University of St. Augustine. What's your name?
Hi, I'm Stacy.
Stacy.
Mm-hmm.
What's your last name? Don't have one. Okay. Smith. How old are you?
I'm 25.
25. Female. All right. What's going on?
I've had some knee pain on my right leg.
So right knee.
Mhm.
Okay. Was there a certain thing that happened, or get in an accident or something?
No, I like to work out a lot, and I started running more. Started running stairs, so I would lose some weight, and my knee started hurting after that.
Okay. So you started running more and doing more stairs.
Doing stairs. I started running stairs.
How long ago did this happen?
2 months.
Has it gotten better or worse, the same since then?
Worse.
Okay. Say it's gotten worse.
Mm-hmm.
Would you say where on your knee would you say that you have an issue? Can you point to it towards the knee? So the front of your knee.
Mm-hmm.
Okay. Would you say there's any warmth or swelling?
Yes, I would say that there is that.
Okay. Could you explain your pain to me? Is it like a burning, tingling numbness, or is it like a sharp, dull, or ache?
No, I can't really tell you.
Okay. If you were to grade your pain, 1 is just barely there, and 10 is so bad you have to go to the hospital. How would you grade your pain right now?
4.
Okay. What about at its worst?
A 7.
And then at its best?
A 1.
What makes it worse?
When I kneel, squat, or use the stairs.
Okay, and then what makes it better?
If I ice it and stretch my leg out straight.
Rest, ice, straight leg.
Uh-huh.
Alright. Have you had this issue before?
No.
Have you had physical therapy before?
No.
Have you, are you taking any medications for this? Any pain medications or anything?
Yeah, I started taking some anti-inflammatories last week.
Okay. And is that helping?
A little bit.
Okay. Are you taking any medications for anything else?
No.
Alright. Do you have any history of you yourself, or have any family history of cancer? You have any indigestion, gastrointestinal issues? Any night pains?
No.
Any fever?
No.
Any unexplained weight loss or weight gain?
No.
Any nausea, vomiting?
No.
Okay. Have you seen a doctor?
No.
So, if you have not seen a doctor, have you gotten any imaging at all?
No. Oh, yes, it says provided by patient. So yes, I must have seen a doctor.
What does the imaging say?
Provided by patient.
Scroll
That's
down
literally-
anywhere.
There's a scale. There's like a survey.
Okay.
But it just
I'll
says,
need that from you later.
It literally just says imaging : provided by patient.
Okay. So what does the survey say on there? Does it show a number, total number? Okay, so you got a 21 on the lower extremity functional scale, LEFS. Do you have any past medical history of like a surgery on that right knee or on the right leg at all?
Mm-mm.
Do you have any allergies or any prior surgery?
No.
No prior injuries? Okay. All right. What is it like at home? Like, is this affecting you at home at all?
Not at home.
Like, are you having any issue? You said you're having issues going up the stairs, so that's one thing.
I live on a first floor, so
You're on
no.
the first floor, so nothing else. Okay. What hobbies do you have?
Well, I like to work out. I regularly do aerobics.
Okay. How is this affecting you in your aerobics?
It's uncomfortable because it's uncomfortable.
Are you able to complete the aerobics and work out or no?
No.
No. So cannot
I've not been participating.
due to pain.
Yeah.
Okay. What do you do for work?
I'm a legal assistant.
You're a legal assistant. Okay. So how's this affecting your work, if at all?
I sit at a desk for most of the day, and if I have to sit with my knees bent for more than 30 minutes, it hurts. So it's really uncomfortable, and it's really affecting my concentration when I'm at work.
Okay, so you're able to work at this point, but you're having troubles after 30 minutes. Okay, so prior to this happening 2 months ago, and it getting worse, you were able to complete all of these things without pain. Am I understanding that correctly?
That is correct.
Okay. What are your goals for physical therapy?
I would like to get back to doing aerobics when working out, and I would like to be able to sit at my desk at work and be non-people.
Okay, well, I'm just going to paraphrase. Let me know if I missed anything or you would like to add anything else. So, you're 25-year-old Stacy, right knee pain on the front of your knee. It hurts when you do stairs. It occurred when you started doing more stairs because you're trying to exercise more. Worst pain is 7 out of 10, best is 1 out of 10. Right now it's a 4 out of 10. You have seen a doctor, but I don't have access to imaging right now. Rest, ice, and straightening the leg makes it better. Squatting, kneeling, and doing the stairs makes it worse. You want to work out and do aerobics, but you cannot go to pain. And you're a legal assistant, and you are able to work, but after 3 minutes of sitting down, you are having some pain. You got a 21 on your lower extremity index or functional index. Is there anything else that you'd like to tell me that you have not mentioned?
No.
All right, so I'm thinking that it is, since the anterior part of the knee, straightening the leg and rest makes it feel better, and then flexing the knee for kneeling, doing stairs, or squatting makes it worse. I'm thinking it's probably patellofemoral pain syndrome, whether it's either patellar tracking or quadriceps tendon, maybe, or patellar tendon. I'm thinking it's one of those 3 options here. So I'm going to want to do, MSTT. I'm going to want to do MLT and MMT. I'm going to want to do special tests. And I'll throw in palpation for tenderness as well. so we're gonna go with the first thing first. So I'm going to go with MSTT. So I'm thinking it's patella anterior knee pain, patella pain syndrome, patellar tracking. So I'm going to do an MSTT. Normally I'd have my patient have shorts on, but we'll have to do. So I'm gonna do an MSTT of the for quad extension.
Okay.
For knee extension with the quads. So I'm gonna provide 2-finger force here, just distal to the knee. And then I'm gonna ask you to match my force. Okay, so I'm just gonna provide a force here. Good. Now, I guess I'm gonna do a screen first. Before I even do that, I'm gonna rewind. So I got the lower extremity functional index. I would do a vitals, so I get blood pressure, pulse, and respiratory rate. Then I want to do a screen. So I'm going to have you stand up. Have you just bring your leg up, both sides. Go and maybe bring your leg out. And then out on both sides, and maybe kind of cross your leg, both sides. Good. I'm gonna have you kind of take your leg back. Great. I'm gonna have you sit back on the chair. Good. So then I'm going to see. All right. So now I'm gonna go to MSTTs. So again, I'm gonna match my force right here, and it's the right side that's affected. So I do the performance bilaterally. So now I go to the right. Then I'm gonna do the back right here. So the hamstrings, back of the hamstrings. I'm gonna have you go into hip external rotation, hip internal rotation, both sides. So I'd be asking the patient each time that if they had pain, I'd be testing if it was weak and or weak or strong, and I'll be asking the patient for symptoms there. I'm just going to do it at the same time for the ankle. So I'm going to have you kind of kick up your foot. I'm just going to have you kind of bring your toe up. Okay? So just match my force there. Good. Same thing over here. Maybe push your foot in. Good. Push your foot in again. You push your foot in. Sorry, out. Push your foot out. You push down into my hand. Push down into my hand. Excellent. So those are the MSTTs. What are the findings of these MSTTs?
Quads are strong and painful, deep to medial patella.
For MSTT?
For MSTT, quads are strong and painful, deep to medial patella.
Strong and painful quads. Pain was described as deep to patella. Okay. Is there anything else, or is it just the quads?
That's it.
Okay. Patella. Got it. So then I'm going to go to MLT. So for the MLT, I am going to muscle length test quads. So to muscle length test the quads, I am going to have you on your, just think this through here. We want to have you prone on your stomach. Get a pillow for you. Which direction would you like to lay?
I'm gonna put my noggin over here.
So, you're on your stomach. So I'm going to test the left side first. So this is your right and this is your left. So what I would do, I would go to full knee flexion. I would grab my goniometer. And I would test for knee flexion. Soft tissue unfeel. So measure the rear trochanter, lateral femoral condyle, and lateral. Lateral malleolus. So we got 35 degrees there, which would be 145 degrees of knee flexion. Same thing over here, all the way down. Again, lateral femoral condyle to lateral malleolus to rear trochanter. Rear trochanter. Again, we're at 140 degrees on this side. So as MLT. Okay, and then I'll muscle length test the gastrux and the soleus just to kind of cover my bases here. So I'm going to have you on your back, please. Okay. So I'm going to do the left side first. So for the gastrux, I'm going to have you scooch down this way a little bit. So I want your ankle off the table. Good. So I'm going to cup the ankle like this. I'm going to dorsiflex the foot. Okay. Grab my goniometer and measure from the lateral malleolus to parallel with the fifth net all the way up to the lateral femoral condyle. And that is 5 degrees dorsiflexion, so that's for gastrocnemius. Then I would put a pillow underneath the knee. To put the gastrux on slack. And perform the same thing for the soleus. So again, foot up here. Full dorsiflexion, flexed. Again, measuring the lateral malleolus to the lateral femoral condyle parallel. Again, 5 degrees. Performed bilaterally. So that is the muscle length test that I would perform. So I would just want to do quads. You could do quads. I'll do a Thomas test as well, just for muscle length test. It's also a muscle length test of the quadriceps. So I might as well just cover my bases. So I want to have you stand at the end of the table here. So I'm going to have you grab your left leg. So I'm going to do the opposite. I'm going to do the unaffected side first. So I'm going to have you grab your right leg, please. Okay, I'm going to have you sit down, lay back. Good. Keep this left leg. So I'm observing to see if it is greater than 80 degrees of flexion, or less than 80 degrees of flexion. So I grab my goniometer again, which is somewhere. Left it. Anyways, my goni, I'd be measuring for knee flexion again, lateral femoral condyle to the lateral or to greater trochanter, and then to with reference of the lateral malleolus. So I perform bilaterally because this is a muscle length test of not only the hip flexors, which include the iliopsoas and the rectus femoris, as well as the IT band and or the sartorius. So this is okay. So now I'm going to do. So if you could give me information regarding muscle length tests.
Thomas test was positive for ITB and quads.
For ITB and quads.
Mm-hmm.
So anterior knee. I guess we could have done Ober's then.
Yeah, you should have.
Okay. IT band and quads. So positive Thomas test.
Yep.
Okay.
And then positive modified Ober for ITB, SLR 80 degrees bilaterally.
Straight leg raise.
Sure.
That's what SLR is? Is
Says
that what you said?
It says SLR 80 degrees.
SLR 80 degrees bilaterally.
Yep. And
Okay, so
positive,
that means that's
positive modified Ober and ITB.
okay.
Okay.
That changes what I'm thinking with those two tests. Okay, so now I'm going to go to MMT.
Okay.
So for MMT, I'm going to manual muscle test the quads. Okay, really quick just to get the rep in, so I'm going to do the Ober's test. I'm going to do it right now. I'm going to have you facing that direction, please. Laying on your side. Grab a pillow. Put that behind me, between me and you. Have you scoot back a little further. So I'm going to do the Ober's test. So that is where extended. I have the straight knee, bent knee, yep. And then I'm going to stabilize the iliac crest, and slowly lower it down. And then I would feel for compensation or of the pelvis. Now I'd measure hip adduction, so ipsilateral ASIS, contralateral ASIS, and then patella. So because the rec fem was tight in the Thomas test, I would do the modified Ober's test, which is where I put the rectus femoris on slack by straightening the knee, stabilize the iliac crest, bring up the leg into slight extension and abduction, slowly lower it down, feeling for any compensation, stabilizing the iliac crest, and then again, let's see if it would go down all the way, which in your case it is. So in this case, there was a positive Ober's test with pain. What did it say? Pain at the lateral knee, or just a positive? What did it say?
Positive Ober IT band.
MLT, modified Ober to IT band, straight leg raise, 80 degrees bilaterally. Thomas test positive, IT band and quads. Okay, so MMT. So there was for MSCT it was strong and painful. So for MMT I would defer because of pain. So MMT deferred. So then that crosses off MSCT, MLT, MMT, And so next one is special test.